Hello everyone. So our today's topic is types of adverse events. So let us understand what are adverse events, who by what means what are adverse events caused, what are their actions, symptoms, and how can we deal with the same. So let's start. So basically, adverse events in local language, we can say that they are the side effects caused by, or the harmful effect which are caused by the medicines or the drugs you consume. That is known as adverse event. That any untoward uh, reaction in your body, any undesirable changes in your body, the some symptoms which are not normal, which are making you feel pain or giving you pain, are known as adverse events. So let's start. What are they, and let us understand how it works. So there are various types of adverse events, like there are various reactions we can say, that is vomiting, dizziness, giddiness, nausea, depression, then thyroid disorders, rashes on the skin, itchiness on your skin, then blood or diminished vision when you see you when you can't see properly, then cramps and pains in abdomen or headache. These all are some reactions which are being seen in your body after after the adverse drug reactions. Now let us understand the adverse drug reactions and its types. So it is divided in type A, type B, C, D, E, F, G, H and U. So let's start with type A. Let's understand what exactly happens in type A adverse reactions. So the type A is augmented reactions, in which the reactions which can be predicted from the study of the pharmacological drug, which the reactions are being known, or the dose is dependent and can be elevated by a dose reduction. So they can be recovered by reduction of dose, but they are known, the reactions are known, but it depends on person's body how do they react. So example are anticoagulants, bleeding, used in bleeding, that beta blockers used in bradycardia, and nitrates for headache. The type B is bizarre reactions which can't be predicted from the pharmacological study, or are not known from the pharmacological studies. They are not dose dependent. Host dependent factors are important for predisposition. So the examples are penicillin and anticonvulsant drugs. Type C is chemical reaction, which like the biological characteristics can be permitted from the chemical structure of the drug. That is the biological reaction which is going to take place, or which has been taken place in your body, can be predicted from the chemical structure of the drug. Example is paracetamol. Type D is delayed reaction, which occurs or which can be seen after years of the treatment in a person's or the patient's body, and can be due to the accumulation of the drugs in the body. Example, chemotherapy, which results in hair loss. Then analgesics and antipsychotic drugs are some examples of the delayed reactions of the delayed reactions. Then it comes about to type E, which is end of the treatment reaction, which occurs after the treatment is completely stopped, and stopped abruptly. And the example of this reaction is phenytoin drug, which causes the end of which cause shows adverse reaction after the medicine is being stopped completely. Next, like the classification of ADR depending upon the severity, that is the intensity of the severeness of the ADR. So It is now the classification is done on the basis of intensity, like whether the adverse drug reaction is severe, moderate, or mild. So let us understand the difference between all of these. So first one is minor ADR or the mild ADR. In simple words, it is the most less ADR which is caused. So no therapy is required for if the ADR is minor. No therapy is required, like if you're getting a high fever, like no therapy is required. Antidote or prolongation of hospitalization is required. No hospitalization is required. Okay, so it is nothing to get serious about it and nothing to worry also. So the next is moderate ADR. Moderate area is like it requires the drugs therapy. You need to show to the doctor or inform the doctor that these all things are happening, these are all changes are taking place in the body after taking the medicines, what all is happening. So specific treatment is required, but it will be cured as the anti ADR drugs when taken, it will be cured. Then the next is severe ADR, which is threatening to our body and causes permanent damage and requires hospitalization. So the patient needs to be admitted in the hospital due to severe ADRs, and the medical treatment is required. And the last stage is lethal. Lethal is when there is death has been occurred due to the ADR, due to the adverse drug reaction of a drug. So when the patient is died after the ADR, it is the lethal ADR. So yeah, that's it. Thank you.